morning, Ms. Cox. I'm Dr. Carter.
Hey.
I'm Chloe. I'm one of your nurses.
I'll raise you up a little bit. Well, we've got your results back. We need to talk about it.
Okay.
All right. Let's tell you the bad news first. I'm afraid you have type 1 diabetes.
No, you're kidding.
No, we've been looking at your lab values. We tested your fasting blood glucose, and you're sitting at about 150 to 155. That's high. That's diabetic range. And we've looked at your A1Cs, and that's more of a long-term thing, and they're still sitting at about 8.
That's why you've been feeling so crappy.
No, this is gonna ruin my life.
It won't ruin your life. We'll be able to manage it.
No.
You just gotta learn how to live with
I don't
it.
have diabetes. You're lying with me.
I don't lie. I call the code white.
Oh, ma'am.
Hello, I'm your nurse today. I'm Maya,
And I'm Jasmine, and I'll be your second nurse.
Hi.
and we're just going to give you some education on what insulin does and what insulin will be giving you. So we're going to give you insulin lispro. That's your fast acting. It works really quickly to bring your blood glucose down. And some things you want to consider after doing your injection is making sure that you eat immediately after. And whenever you do your injections, you want to rotate sites to prevent buildup of scar tissue. And then you want to roll the valve instead of shaking.
Okay, and this, it's a therapy, it's long term, it's not a cure, it's not going to, like, make your diabetes go away. You're just going to be able to maintain your diabetes. And if you have any signs of hyper or hypoglycemia, you should immediately contact your healthcare provider, and that's things such as sweating, loss of confusion, and things like that. And it should be stored in a cool place, but not in a refrigerator.
Okay.
Okay, now we're going to demonstrate how to do the insulin injection. So first I'm going to clean the valve. And we're going to give her 5 units. So I'm going to withdraw 5 units of air. And now I'm going to inject those 5 units of air and withdraw 5 units of the insulin. Okay, and do my second nurse checkoff.
And that is 5 minutes.
And then before I inject, I'm gonna wipe the abdomen. And then I'm gonna pinch the skin. And now I'm going to inject. Okay. And that's how you do the injection.
You got here fast. I'm gonna take you down.
All right, so we're going to talk about your high alert medication. So you're going to see this drug under the names of Humalog or Lispro. The way this drug works is it acts like your body's natural insulin, and it lowers your blood sugar levels.
Okay. How often do I need to take that?
Well, we'll give you a sliding scale. This could depend on how high your blood sugar is, whether you take it, and however many units correlates to that. So the nurse will get that to you eventually.
Okay.
This drug has a little bit of interactions when you take it with corticosteroids or estrogen. It's going to increase your insulin requirements, but if you take it with ACE inhibitors such as lisinopril or something, or alcohol, it may decrease your insulin requirements. This has a quick onset, so you have it 5 to 15 minutes with a peak of about 1 to 2 hours, and a short duration of 3 to 4 hours.
Do I need to eat food with that?
Well, yes, you're going to take it with your food.
Okay.
So you need to monitor this a lot. We'll have you come back to your specialist, and you'll every 3 to 6 months we'll look at your A1C levels. We're going to teach you how to monitor for signs of low and high blood sugar. For low blood sugar, you're going to see lightheadedness, nausea, nervousness. When you got your high glycemia, you're gonna have flush skin, thirsty, excessive urination. So these are things you're gonna want to look at. Monitor your body weight. Always have food or a snack with you if it does get real low. But like you've already asked, you need to eat food right after. Rotate the sites of your needle. I think the nurses taught that to you.
She did.
Okay, good. Discard your needles. Yeah. Do you have any plans on getting pregnant anytime soon?
Nope.
Okay, because that can throw some things off with insulin. May increase your requirements for it. So
Okay.
make sure you alert your provider for that. Yeah, that should be it.
Thank you.
Yes, ma'am.
Common side effects, adverse reactions, or toxicities include hypoglycemia, swelling, redness, and pruritus at the injection site. The cost of the drug is a base price of $163 without using a Good RX coupon.